So here we're going to talk about just some basic items in regards to pharmacology, primarily just a lot of defining terms, and again, just looking at some of the background between some basic ideas and some items related to pharmacology. So one of the things we want to look at are the names of drugs. So essentially, when you look at a drug name, you have three different types of names for drugs. You have the chemical name, the generic name, and the trade name. So the chemical name is the long name of the drug, and it basically looks at the chemical structure. So it's basically just strictly named off the actual chemical structure of the drug. The generic name is the non-proprietary name and is usually shorter than the chemical name, but it comes from it. So for instance, ibuprofen is a generic, would be your generic name drug. And then you have your trade name, which is your brand name that's assigned by the manufacturer. Now the trade name's proprietary, so it can't be used by other manufacturers. So there's only one generic name for each drug, but you could have multiple trade names. Okay, so for instance, like again, just the example I gave, ibuprofen, you have Motrin, you have Advil. Okay, those are different trade names. So generic name shouldn't be confused with generic drug. So every drug does have a generic name. And essentially, your generic drugs are copies of the brand name drugs whose patents have expired. So, for instance, when a company comes up with a drug, they get a patent. That patent's only good for a number of years, and then it can be released as a generic drug. Generic drugs do tend to be less expensive. However, they're basically they're just as effective. The generic drugs that you buy have to be therapeutically equivalent, meaning they have to have the same chemical makeup and active ingredients as the trade name. So, again, if you go and you buy generic ibuprofen, it would be just as good as Advil, because again, it has to have that therapeutic equivalency. Here are some dosage abbreviations, and there's going to be some other abbreviations I'm going to have posted the page and the chart that I want you to know certain abbreviations. These just refer to dosage abbreviations. So, BID is twice a day, TID is 3 times, QID is 4 times, and PRN is as needed. Again, make sure you look at the other abbreviations that I'll have posted, because you'll be responsible for knowing those as well. So when we look at drug classifications, again, there's going to be 3 major classifications of drugs. You're going to have your over-the-counter drugs, your prescription drugs, and your controlled substances. So over-the-counter drugs obviously don't require a prescription, and many of them were originally prescription drugs but had been approved by the FDA as a non-prescription drug. So, for instance, years and years ago, a lot of the second generation antihistamines that were, allergy medications, things like Allegra and Claritin, they were only available by prescription at one time, but then the FDA decided to approve them for over-the-counter use. Over-the-counter medications are usually less expensive than prescription drugs, but they can be purchased again by anybody at any type of store. Your prescription medications obviously require a prescription. They're typically associated with a greater potential for adverse reactions. So, they're usually going to be taken for a limited amount of time, and then the patients have to get them, if they do need a refill, they have to get that refilled through their physician. So that has to be authorized through the physician. Now, controlled substances also require a prescription, but they're controlled substances because they have a greater potential for abuse. So, and then there's the schedule for controlled substances, which we will have talked about. And you can see in table 3-4, they have the controlled substances in the clinical pathology text. But these are again a special classification of drugs that the drug enforcement agency is responsible for overseeing a lot of the aspects as to how these drugs are manufactured and distributed and stored. Again, they have the highest potential for abuse. When you look at your scheduled drugs, they're scheduled 1 through 5, with 1 being the greatest potential for abuse and 5 being the least potential for abuse. But these require a different type of, so if you're going to have controlled substances at your facility, they require a whole other level of regulation as opposed to prescription and over-the-counter drugs. So again, here's your controlled substances, and you can see some examples. So again, in the clinical pathology text, they actually do show some examples, so it kind of lets you know what what types of medications could fall underneath these. So again, the highest potential for abuse is going to be your Schedule 1. Your Schedule 5 is going to be the least potential for abuse. We look at routes of drug administration, so various ways that drugs can enter the body. So enteral is it enters the body by way of the alimentary canal or digestive system. Parenteral is going to be a pathway other than through the alimentary canal or digestive system. So the parenteral, or what they also call non-enteral, this will allow a drug to be many times delivered directly to the target tissue. As far as the enteral route, you obviously it has to go through digestion in order to be distributed then through the circulation, then go out throughout the body. So the parenteral approach does give you a little bit more of a targeted delivery of the drug. So here are your examples of enteral versus parenteral. So your enteral, you obviously have your oral medications, sublingual, which will be administered underneath the tongue, rectally and buccal administration. Your parenteral, you have inhalation, injection, and then topical or transdermal. So again, depending upon the medication and how it needs to be delivered and how important it is to get to the particular target tissue will kind of dictate the medium by which it gets administered. So again, looking at the way drugs get administered, going a little bit further with it, again, the oral route's probably the most common route that we think of. Again, one disadvantage of this is that, the stomach acid may completely inactivate the drug and possibly reduce the therapeutic effectiveness. So the dosage, obviously, and how often a person takes it, that'll be impacted by that. They also take a little longer to provide a therapeutic effect. So many times it could take up to 30 minutes for any type of tablet or capsule to have the intended therapeutic effect. It's also very important when you take medicine orally, it's highly recommended to take with a full glass of water, just because it'll help it move the medication into the small intestines where it's going to be absorbed. So that's an important thing. And it's also important to note that some types of food can also interact with medication. So you have to make sure that there's no food that's going to potentially interfere with the effect. An important thing to note that some drugs will have what's called an enteric coating on them, and that's designed to delay the release of the medication until it reaches the small intestine. So this is usually just done just to kind of protect it as it's passing through the stomach and then allow the medication to be absorbed a little bit more. If we look at the injection, there's various forms of injection. Again, this is just going to allow the medication to get to the target a little bit faster. So you have intramuscular, intravenous, subcutaneous, or intraarticular. So those are various ways that you can have medication get delivered. Obviously, intravenous is a very common way for a lot of medications to get delivered. That's just going to allow the drugs to be directly injected into the vein, again, which will allow for a greater effect. So those are some of the other ways in which medications can be injected. You have your intranasal. You also have oral inhalation. So many of your, for instance, your asthma medications are administered through oral inhalation, intranasal. It's very common to see a lot of, some examples of that would be many of your corticosteroids for instance, for seasonal allergies, can get administered via intranasal. You have your sublingual and buccal. These are both ways. So sublingual is basically underneath the tongue, as we had talked about earlier. Buccal is just inside the cheek or directly on the gums. Again, these drugs will tend to get absorbed very quickly when they're administered that way, because there's a really rich blood supply to that area, so it allows the drug to be absorbed very, very quickly in that regard. Rectally, the most, again, your suppositories is your most common dosage form when you look at administering a medication through the rectum. Many times this is often used to administer things like antiemetics, because if someone's having severe vomiting, it's going to be hard to keep medications down. So obviously, if somebody can't keep a medication down because they're vomiting, that'll be the way in which the medication will be administered. And sometimes it's also not uncommon for like a lot of your laxatives for individuals who are having constipation to be administered rectally as well. And then there's some other applications. Again, we look at local effects. So just so you're aware, you have your ophthalmic for the eye. So many issues involving the eye. So for instance, it's there's antibiotic medications. For instance, people that have bacterial conjunctivitis, there'll be an ophthalmic administration. Otic is in the ear, and then topical is anything administered through the skin. So again, I kind of mentioned some of this a little bit already, but just to kind of, I guess, summarize some things. So most of your immediate effects are going to be produced by things that are administered intravenously. Inhalation's also very fast, whether it's oral or nasal, and then sublingual absorption will be pretty quick as well because of the blood supply within that tissue inside the mouth. Again, anything administered orally may require up to 30 minutes before relief is provided, and again, that's just because it has to get absorbed by the blood supply through the digestive tract. So it'll take a little bit longer in that regard. And then again, as I said, it's very important, and people should be taking a full glass of water with any type of oral medication, just because it allows it to be absorbed better. Liquids or powders dissolved in water do tend to act a little bit more quickly than tablets and capsules, just because, again, they're kind of broken down a little bit more, as opposed to the tablets and capsules, which will kind of have to be dissolved within the digestive tract. And then you have your learning outcomes here. So real short talk, just to kind of talk about some basics and some terms. Some of these things I believe I even mentioned in one of the previous talks, but this is just a nice way to kind of summarize some of this, so that as we kind of go through some of the particular types of the different types of drugs that we're going to be discussing, then you could be familiar with some of these terms and make that discussion a little bit easier.